my rubric. All 3 pages. Hopefully, just only except for my name on there. But that's not going to be really well. Hello.
Hi.
Hi, my name is Ava. I'm going to be a student nurse today. How are you doing today?
I'm good. How are you?
I am good. Thanks for asking. I am going to be doing your head to toe assessment on you if that's okay.
Yeah.
Perfect. So I'm just going to ask you a couple broad questions, and I'm just going to ask you health history questions.
Okay.
So first things first, what is your name and your date of birth?
Lexi Demore, 7/8/05.
Okay, perfect. Do you know what year it is?
2025.
Perfect. And then do you know where you are?
SVSU.
Okay. So you're ANO times 3, so I feel comfortable moving on with this assessment. And I'm just going to ask you health history.
Okay.
Any allergies?
No.
Any medications, including herbals and supplements?
Nope.
Any past or recent medical diagnosis?
I was diagnosed with encephalitis when I was young.
Any complications or any flare-ups?
Not recently.
Okay. How about with past surgeries or recent surgeries?
I did have a port put in and taken out for my encephalitis. My gallbladder was removed, and then my tonsils and adenoids and my wisdom teeth were removed as well.
Okay. Any complications or flare-ups during those times?
No.
Okay. Any family history?
No.
Any recent hospitalizations or past ones?
Nope.
And then how was your diet like?
Pretty good.
Very good. Getting 3 meals a day?
Yeah.
Perfect. And then how was your physical activity?
Good. I do something every day.
Okay. And then how is and then do you have any history of smoking, tobacco use, marijuana, vaping?
Nope.
And then drinking?
No.
Okay, perfect. So I'm going to go ahead and move on. So first what I'm going to do before I check your vitals is make sure to check for clubbing. Okay? So I'm just checking for clubbing, making sure that there's nothing. Alright, everything seems normal there. And so since I just checked her clubbing, and so if I did have a pulse ox, I will put it on and I'll expect it to be in normal ranges. And then also if I did have a thermometer, I would check her temp and expect it to be in normal ranges, but I'm just gonna feel with my hand. Nice good skin temp. Everything's good. Do you feel warm at all?
Nope.
Okay. And so next what I'm just going to do is check your blood pressure.
Okay.
Okay. All right, and then do you have an arm preference?
No.
Okay. So I'm just going to go ahead and check in with your left. Oh, and also before I get started, are you in any pain at all?
Nope.
Okay, perfect. I'm just going to go ahead and move on. All right. Oops, sorry.
You're good.
Your gown was just in the way for some reason. All right. Does this feel good?
Yep.
Okay. I'm just going to check for your brachial artery. Okay. Nice and strong pulses. So that's where I'm going to be listening to your blood pressure. Checking with my diaphragm. Make sure that your legs are uncrossed. All right, I got 102/76. Is that normal for you?
Yes.
Okay, perfect. So next I'm just gonna go ahead and do your manual pulses. I'm just gonna do your manual pulse and it's gonna take between 1 to 2 minutes, okay?
Mm-hmm.
Okay, just gonna check with her radial pulse. Feeling a good strong pulse. I'm just going to test it for about 1 to 2 minutes. right. Your pulse was 71, and then your respirations were at 16. So those are normal ranges, so no concerns. Okay, so the next one I'm just going to do is inspect your arms, if that's okay with you.
Okay.
Sorry.
You're good.
Okay. So just like, like inspecting, I do see you do have moles on both of your arms, and that's normal for you?
Yeah.
Okay. And I do see you do have a tattoo. Any complications and any pain or tenderness when I touch?
Nope.
Okay. So the next one I'm just going to do is start doing your pulses, checking them, and see if they're symmetrical, okay?
Mm-hmm.
So I'm just going to check for your brachial pulse. Nice and symmetrical and strong pulses. So next I'm just going to do a check for your radial. Nice and symmetrical, very strong pulses. No concerns. And so the next I'm just going to do is check for your muscle tone, making sure that your arms are nice and symmetrical. Sorry, didn't mean to bump in your knee.
You're good.
Okay. So now I'm just feeling good muscle tone, nice and symmetrical. Skin color looks good, temp is good. So next I'm just going to do is check for your in between your fingers and your perfusion capillary refill, okay? So I'm just going to check just to make sure I'm not seeing no warts, no dryness, no skin breakdown, no moles, not normal moles. Just checking. And good skin color, good skin temp on your fingers as well. Okay. So next what I'm just going to do is check your capillary refill, okay?
Mm-hmm.
For perfusion. And let me know if you're in any pain, okay? You're coming back nice and pink. No concerns. And so next what I'm just going to do is do your strength test and then do ranges of motion, okay?
Okay.
So I'm gonna pull this down for you. Okay. Okay, so I want you to squeeze my fingers as hard as you can. All right. And then I want you to put your hands out like this for me and push them inward. All right. And push them outward. Put your hands up. Push up. And then flip to the other side. Push down. All right, good. Good strength. No concerns. And so next I'm just going to do is do your ranges of motion, okay?
Mm-hmm.
Okay, so I want you to turn your wrist inward for me. Only hearing a little bit and feeling a little bit of crevice in your wrist. Is that normal for you?
Yeah.
Okay, and then turn them outward. All right, feeling a little bit more crevice in both of your wrists. I know that you said that was normal for you. And if you don't mind them flexing your elbows for me, feeling for any of that. No crevice there. All right. And so next I'm just going to do is have you do a swimming motion. Do you know how to do that?
Okay, yeah.
So I'm just going to check your ranges of motion on your shoulder. You can go ahead and scoot up if you like.
Okay.
Feeling a little bit of crepitus. All right, and then turn it back. And is it normal hearing cracking in your shoulder?
Yeah.
Okay. On this side. I'm not feeling no cracking over here or crepitus. All right, good. And so next what I'm just going to do is lift up your gown, and I'm just going to check with your reflexes.
Okay.
Okay. I'll lift this up. And so I'm just going to have you kick out your legs. Kick them out again. I'm not feeling no crepitus there. And so next I'm just going to do a check for your patellar reflexes.
Okay.
Okay? If you don't mind closing your eyes for me. All right, good. Good patellar reflexes, no concerns. And so next I'm just going to do is do the same thing with what I did on your wrist, with ranges of motion and your strength test.
Okay.
Turn your ankles inward for me. All right, a lot of crevitus in both your ankles, normal.
Yep.
Okay, backwards. All right, crevitus, I know you said that it was normal for you, so no concerns. So next I'm just going to do is do a strength test.
Okay.
Okay? So same kind of concept. So push your feet inward. Right, push them outward. All right, push them up. And then push them down. All right. Oh, that was a good crack. I know that probably felt good. So I'm just gonna apply on some more hand sanitizer since I was on the floor. Okay. So the next one I'm just going to do is start doing my head to toe assessment on you.
Okay.
So I'm just gonna feel for symmetry on your head. I'm not feeling no signs of swelling, no bumps, no indentation, everything good there. And so next what I'm going to do is have you take out your hair for me. Excuse me, sorry. Okay. And then do you have any home infestations I need to know about?
No.
Before I get started? Okay, perfect. So I'm just checking to make sure that her scalp is nice. I'm not seeing no discoloration with her scalp. I'm not seeing no warts, no moles, no abnormal moles I didn't know about. And I do see that you have moles here. I know that you said that in the beginning that it's normal for you.
Yep.
And you're concerned with it. So next I'm just going to do is check your other side. And also checking for dandruff as well. Not seeing anything abnormal. No concerns, just checking your neck again. Alright, perfect. You can go ahead and put your hair up if you like. Okay. Okay, so the next thing what I'm going to do is test for your sensory function and your motor function of your trigeminal nerve, cranial nerve 5.
Okay.
Okay? All right. So I'm just going to grab my Q-tip. And then I'm just going to point to a location on your face and you're going to tell me where that's at, okay?
Mm-hmm.
So you can go ahead and close your eyes for me.
Left cheek, nose, right cheek, forehead, chin.
All right, good. Seems like everything is good there. So next what I'm just going to do is check for your jaw, okay? All right, cleanse, uncleanse, cleanse, uncleanse. All right, good. Seems like everything is good there. So next what I'm going to do is check for your facial nerve, cranial nerve number 7, okay? So I'm going to do is have you make some funny little faces, if that's okay.
Mm-hmm.
Okay? So puff your cheeks up, unpuff, make a sad face, make an angry face, make a happy face, and then raise your eyebrows. Good? Everything is intact with that, no concerns. And so next what I'm just going to do is check for your sinuses, okay?
Mm-hmm.
And let me know if you're in any pain.
Okay.
Your frontal sinus, any pain or tenderness where I'm touching?
Nope.
All right, I'm not feeling no abnormalities. I'm just feeling with your maxillary sinus. Any pain or tenderness here?
Nope.
All right, good. Seems like that everything is good there. And so next what I'm going to do is check for your eyes, okay?
Okay.
So I just want you to show your eyes for me. Just checking your eyelids and inspecting. I'm not seeing no irritation, no signs of abnormalities, of lesions, or any bruising. So everything is good there. So you can go ahead and open up your eyes. And so next what I'm going to do is check your eyeballs. I'm just going to lift up your upper eyelid. You're going to look down. And I'm going to do the same thing, but pull down your lower eyelid and then look up.
Okay.
Okay. So let me know if you're in any pain. Right. Any pain?
Nope.
Right. Nice pearly white sclera. No concerns. You don't mind looking up for me. Your conjunctiva seems nice and pink. No concerns. I'm not seeing no signs of drainage, no discharge, no dryness, no crust. Everything is good there. So then next, and I'm just looking to see your eyes are symmetrical and your facial as well. Before I move on, everything is good. I'm not seeing no signs of facial drooping at all. Okay. So next I'm just going to do is just do some couple of eye testing, and then I'm going to move on to cerebellar function after that. Okay. All right. Perfect. All right. So this first one is just going to make sure that your pupils are reacting to the light. Okay.
Mm-hmm.
For pupil reactivity. Just look at me. Reacting pretty quick. All right, good. No concerns. Really normal. And then next what I'm going to do is check. So I'm going to be checking for pearl and making sure that your pupils are equal and are reacting to the light. And also I'm going to be checking for accommodations. So this is called a corneal light. And so I'm just going to have you look at my nose, okay? Everything's good there. Everything looks symmetrical with your pupils and your eyes. No concerns, and good even reflective to the light. And so next I'm just going to do a check for accommodations. So I just want you to look at my pen, look at my hand, okay?
Mm-hmm.
So pen light, hand. Pen light, hand. Pen light, hand. All right, everything's good there. No concerns. Everything's normal. Next what I'm going to do is check your 6 cardinal fields of gaze. So it's going to check your cranial nerve 3, which is your ocular motor, which is checking for extraocular movement of your eye. And then checking cranial nerve 4, which is your trochlear, which is going to be testing with your eyes going down and inward. And then it's going to be testing for cranial nerve 6, which is your abducens, which is lateral movement. Okay? All right, so just follow my pen line, okay? All right, perfect. No concerns. Everything seems normal. And so next what I'm going to do is check for your cerebellar function. Okay? So I just want you to touch your nose, touch the pen light.
Okay.
Touch your nose, touch the pen light, 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 touch your nose, touch the pen light. Okay? Everything seems normal there. No concerns. And so next what I'm just going to do is have you make an okay sign for me. And then just move on with touching every single thing of your fingertips and moving as fast as you can. All right, everything's intact, normal, no concerns. So next what I'm going to do is have you put your hands down on your thighs, flip them up, flip them down, do it as fast as you can. All right, good, no concerns. Everything with your cerebellar function is normal. And so next what I'm just going to do is check your eyes, or check your ears. Okay, sorry. Just making sure that they're nice and aligned. No concerns. Everything seems good. And so I'm just going to inspect. All right. Let's see the abnormalities, good skin color. All right. And so I'm just going to feel, okay. Any pain that where I'm touching?
Nope.
All right. And I do see you do have earrings in. Is any concerns with that?
Nope.
All right. Just checking with your other ear. All right, I do see you do have a mole there.
Yep.
I know that you said that you get those checked yearly.
Yep.
So no concerns. And then any pain with that piercing over there?
Nope.
Okay, perfect. So then, and then I'm going to check your ears, inner ears.
Okay.
All right, everything seems clear there. All right, clear there. No concerns with it. And so next what I'm just going to do is check your nose, okay?
Okay.
So just have you lift up. So look up really quick. Your inferior turbine seems nice and good, no concerns. And then your mucous membranes are pink and moist, no concerns. And then I don't see any signs of polyps or any deviated septums. Okay. And so next what I'm going to do is check for your cranial nerve 1, which is your olfactory nerve. So before I get started with that, I want you to close one nostril and then breathe in and out for me. Okay, and then the other side. All right, perfect. So I'm not seeing no concerns. So I'm just gonna have you close your eyes, and then I'm going to put something up to your nose, and you're gonna tell me what you're smelling. Okay? What are you smelling?
Coffee.
All right, good. Seems like everything is normal and intact with that. Okay. So the next I'm going to do is just move on to your lips.
Okay.
Just looking to see if they're nice and symmetrical. They are. No, I'm not seeing no concerns, no bumps, no abnormal lesions on your lips, no dryness. Everything seems good and it's nice and pink. No discoloration, no signs of cyanosis. And then so I just want you to pull down your lower lip for me. All right. Everything seems good. Pink and moist mucous membranes. No concerns there. No signs of infection. If you don't mind opening up your upper lip. All right. Everything seems good. No concerns. And so now, if you don't mind opening up your mouth for me. All right, I'm not seeing no signs of cavities. Everything seems pink and moist. No concerns. I'm just seeing your hard palate up, or seeing your soft palate up here. And lift up your tongue for me. Your hard palate seems nice and moist and normal. No concerns. And so next I'm just going to do is test for your cranial nerve 10, which is your vagus nerve.
Okay.
Okay? And it's going to be testing your gag reflex. So you're going to open up your mouth for me. And stick out your tongue. And say, ah. Alright, good. Everything is normal with that. And then your tongue is nice and symmetrical as well. And so next I just want you to do is stick out your tongue and move it side to side for me. Alright, good. And that was testing on cranial nerve 12, which is your hypoglycemia. And no concerns with that. And so next what I'm just going to do is check for your spinal accessory nerve, which is cranial nerve number 11, okay?
Okay.
So I'm shrugging up, shrugging down, shrugging up, shrugging down. And so the last thing I'm going to do is check for your lymph nodes.
Okay.
Okay? Preauricular, postauricular, occipital, submandibular, submental. And then I'm going to check as well, just making sure that your trach is nice and aligned. No concerns, and I'm feeling good skin temperature, good skin color. And I do see you do have some moles up there. No concerns.
Mm-hmm.
So next I'm just going to do is test your cranial nerves 9 and 10, which is your glossopharyngeal, and then your vagus nerve, which is both testing for swallowing. Okay, so you just go ahead and swallow for me. So again, all right, good. So no concerns. So I tested your cranial nerve 1, which is your olfactory nerve, and cranial nerve 2. I'm not going to be testing because I need a Snellen chart, which is your optic nerve, cranial nerve 2. 3, which is your ocular motor. 4, which is your trochlear. 5, your trigeminal, which was testing your sensory motor function. Cranial nerve 6, which is your abducens, your lateral movement. Cranial nerve 7, your facial. Cranial nerve 8, which is your vestibular, and that's going to be testing for your hearing and balance, but that's going to be on to the last thing we're going to be doing is your Romberg. Cranial nerve 9, which is your glossopharyngeal. That was testing for your swallowing. And then you have cranial nerve 10, which is your vagus, which was testing for your gag reflex and also for swallowing. And then cranial nerve 11, your spinal accessory, moving up your shoulders. And then cranial nerve 12, which is your hypoglycemia. So next what I'm just going to do is check the rest of your lymph nodes, okay?
Okay.
Deep cervical chain. Everything's good there. If you don't mind clenching up your shoulders. Just checking supraclavicular. Seems nice and intact and symmetrical. Just checking for skin turgor. No signs of dehydration. Everything seems normal. So before I move on to the back, I'm going to check your carotid arteries.
Okay.
So I'm just going to slightly palpate them just to make sure I'm feeling it and making sure I'm in the right spot. Okay? If you don't mind. Everything is good there. So I'm just going to listen super quick, okay? So now I'm going to be switching to my bell side to listening for any bruise. All right, I'm not feeling no bruise. I'm going to do the same thing on the other side, okay? Lightly palpating. Nice and strong pulses here. That's where I'm going to be filming. All right, not seeing no signs of bruise or hearing no wishy-washy. So I'm just going to check my sheet just to make sure I have everything down before moving on to the back.
Okay.
Okay? I'm going to go ahead and move to the back. So I'm just going to do some hand sanitizer. So just go ahead and move to the front. Okay. So then first what I'm going to do is check for her thyroid. So I'm just gonna feel lightly feel, not putting any pressure. So I'm just feeling where her Adam's apple is, which is like right around here. Just gonna feel. All right. So Lexi, I want you to do is I'm gonna put some pressure on your throat, and then you're just gonna swallow for me, okay?
Okay.
It's gonna feel kind of weird, okay? Swallow. All right. Do the other side. Swallow. All right, good. No concerns. I'm doing one hand at a time because that's where her carotid pulses are, and if something happens and I put a lot of pressure, she can pass out. So the next what I'm going to do is now I'm going to move on to your respiratory. So if you don't mind scooting up for me, I'm just gonna untie this. All right. Okay. So if you don't mind moving to the back. Okay, so now I'm just going to do is inspect first. I know that when you said in the beginning that your moles are normal, and I just wanted you to know you did have some moles in the bag, so you do know about those?
Yep.
Okay, so no concerns. So I'm just now feeling her skin temp, making sure that's nice and warm, and it is, so no concerns there, and her skin is a nice skin tone, so no concerns. And so I'm just making sure that her spine is nice and aligned, and I'm not seeing no signs of scoliosis. And so next what I'm just going to do is check to make sure where her T10 ends. All right. Sorry if my hands are cold. Breathe in and out for me. All right, do it again. One more time, I'm sorry. All right, so it's just like right here where her T10s end at. So right where that mole is, that's where it's at, right here. Okay. So now I'm going to do is listen for your lung sounds. And so I'm just going to unclench your bra, if that's okay.
Yeah.
Sorry. If you don't mind shrugging your shoulders back. And then unshrugging. I'm going to have you do the same thing in just 1 second. I'm just going to put my things on. So now I'm switching back to my diaphragm. Okay. So shrugging your shoulders back. All right. Shrugging them out. All right. Oh, and also before I start, take some nice, so where I'm placing my stethoscope, I'm going to be placing it, and then you're going to be taking some nice and deep breaths for me. And please let me know if you're in any pain at all, okay? So I'm just going to have you shrug your shoulders back for me, and unclench them. So this is where her scapula is. Everything is good, okay? All right, take some nice deep breath. Breathe in and out. Breathe in and out for me. I am so sorry. I misplaced, so I'm just going to redo it again. I am so sorry. Okay. So same kind of concept, okay? Do you need a minute?
No.
Okay. All right, take some nice deep breaths. Take another deep breath for me. All right. Seems like that your lungs are nice and clear. So no concerns. And then so next I'm going to do is percuss.
Okay.
Okay? So same kind of concept, okay? But no breathing, just relax. So now I'm going to be feeling only for residents. All right, sounds good. And so now I'm just going to clench your ball, and all I heard was residents, okay?
Mm-hmm.
All right. So now you can go ahead and lay down. So now you just lay down. Okay. Would you like the blanket?
Yes, please.
It's nice. It's cold in here. Okay. So next I'm just going to do like this. I mean, sorry, my hands are cold. And so now what I'm just going to do.
I'm just gonna
No,
take
you're
my
good.
hair out.
No, you're good. And so first I'm gonna do is check for your JVD, okay?
Okay.
Do you have enough room to lay down flat?
Yeah.
Okay. So I'm just gonna remove the pillow, and I want you to turn your head to the left. Just checking to see if there's any any present of JVD. No concerns. You go ahead and turn your head the other around. Seeing no concerns there with your JVD. No concerns. Everything seems normal. So you can go ahead and put your head on the pillow. And so next I'm just going to do is a cardiac assessment.
Okay.
And so I'm just inspecting first. I know that you said that your nose are pretty normal. I just want you to be aware that it's on your chest. You are aware?
Yep.
Okay, perfect. And I do see where your port was placed. Is there any pain?
Nope.
Or tenderness at all? Okay.
No.
And so just making sure for skin tone. All right, everything seems good with your temperature and your skin color is good. And so next what I'm just going to do is start doing a cardiac assessment, okay? Okay. So now I'm going to be feeling for the aortic valve, okay? I am so sorry. My hands are so cold.
You're good.
First clavicle, space, or first rib, space, second rib, space. So I'm just gonna move on to here. So now I'm on my diaphragm side, checking for love dub, love dub. All right. And I'm just gonna flip my bell over, listen to any murmurs. Not hearing no murmurs on her aortic valve. And that was on her second intercostal space. So next I'm gonna be moving on to the left side and listen for her pulmononic first and her second intercostal space. So here's our clavicle. First rib, space, second rib, space. Just gonna move a little bit over so I'm not close to the sternum. And so now I'm switching over to my bell, or my diaphragm. So I'm right here listening to her pulmononic valve. All right, I'm hearing love dub, so no concerns. So I'm in the same spot. Switching over to my bell, listening for any murmurs on her other side. Not hearing no murmurs there. So I'm in the second intercostal space. Moving down to your third. And here is your third intercostal space right here. And this is listening to your herbs point. So now I'm switching over to my bell. Or my diaphragm, sorry. I'm listening to the herbs point, which is the loudest beat you're listening to in the heart. Nice big love dub. I'm switching over to my bell, listening for any murmurs. Sorry for your bra.
You're good.
All right, no concerns. So now I'm in our third intercostal space, fourth intercostal space. No, that was her fourth rib. Now I'm in her fourth intercostal space right here. So this is her fourth rib. Now it's her intercostal space right here. And so this is her tricuspid. So now I'm switching over to my diaphragm. Listening for love dub. All right. Everything is good there. And so switching over to my bell. Listen for any murmurs again. All right. So I'm just gonna count again to see. First rib, space, second rib, space, third rib, space, fourth rib, space, fifth rib, space. I'm like right here. And so this is her mitral valve, and I'm just gonna go mid-clavicular to her nipple. Making sure that that is good. Okay, I'm in line. I'm just gonna lift this up if that's okay. Yep, I'm in the right spot in the intercostal, fifth intercostal space. So now I'm switching over to my diaphragm again. Now I'm just listening. Okay, so now I'm switching over to my bell side. So now I'm listening for any murmurs. All right, now listening to any murmurs, and now I'm gonna flip back to my diaphragm and listen for any apical, and then listen now to her apical pulse. For about 1 straight minute. All right. Your pulse level was at 74. It's just 2 beats higher. No concerns. And so next what I'm just going to do is cover you up. Oh, sorry.
Yep.
Okay. So next I'm just going to do is do your abdominal.
Okay.
Area. Do an abdominal assessment. So I'm just gonna go ahead and then I'm gonna pull this up super quick, just a little bit, so you can get. So I'm just gonna give you some privacy. Let me know when you're ready.
I'm good.
You good?
Yeah.
Okay. So it's okay if I pull this down?
Yeah.
All right, perfect. All right. So then first what I'm just going to do is inspect your aorta. I'm not seeing no signs of peristalsis. Seeing good beating, good pulse, good strong pulses. Over here, I'm just seeing a slight pulse over here, and it's normal. Okay. So then next what I'm just going to do is check for your aorta and then your renal and your iliac arteries, just to make sure that everything is good there. Listening for bruits. Okay.
Okay.
Okay. So I'm following the umbilicus and your xiphoid process, and then also is this belly piercing pain or any complications with that? Okay, so I'm following with the umbilicus and with the xiphoid process, lightly patching into the middle, no pressure, and just lightly making sure on my bell side. No, switching over to my bell. I'm gonna do the same thing. The umbilicus, xiphoid process, with no pressure. Putting just a lightly pressure on it so that I can feel. And I'm putting it with my bell. Listening for any bruits. All right. Not feeling no. I'm not hearing no bruits. And so next one I'm just going to do is house out. Just listening to your renal artery. Listening, same thing, bell side. Listening for any bruits here. All right. I'm feeling no abnormalities there. We're not hearing no bruits. All right, I'm gonna check the other side with your renal artery, okay? Not hearing no bruise there, no wishy-washing. And so next what I'm just going to do is listen to your iliac arteries. So xiphoid process, epilogus moving into the middle, housing outward, and then moving down. And you're gonna find it right above the iliac bone. So right here, same thing, bell listening for any bruise. All right, not hearing nor any bruise. Gonna do the same thing. The umbilicus, the xiphoid process, meeting in the middle, housing out, and then putting it down. Yep, and then so now I'm gonna listen to the other side right here, and this is just above the iliac bone right here. Same thing, listening for any bruise. All right, I'm not hearing no concerns of bruise on either your renal or your iliac artery or your aorta. No concerns. Just gonna make sure to check again with your aorta. Checking again. Okay, no bruise there. And then so next what I'm just going to do is do my abdominal assessment. So I'm just gonna auscultate 4 of your quadrants and just listen to 5 to 30 gurgles, okay? And then when was your last bowel movement?
This morning.
This morning? Okay. So this is her right lower quadrant. All right, 5 gurgles here. And I'm moving on here. Five gurgles. Five gurgles there. All right, seems like that everything is good with that. Hearing 5 gurgles on each quadrant, everything's good. And so next what I'm just going to do is I'm just going to check again to make sure I was on my diaphragm. Okay, good. Just wanted to make sure. Okay, so next one I'm just going to do is percuss, and so the only thing I'm going to be hearing is tympany. If I hear dullness in any of your quadrants, then that would be a concern. So I'm just going, and then I'm also, before I do, I just want to inspect again just to make sure I know you, and then you're aware of your moles on your stomach.
Yep.
Okay, and then just good skin tone as well. Let me make sure to check that. All right, good skin color as well. So I'm gonna start in the right lower quadrant and work my way around on the 4 other ones, or in the 3 other ones. Tympany. 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 All right. I am hearing that, and then so now I'm going to do the same thing and just go up to your liver border just to make sure where that's located, and then I'm gonna be hearing dullness.
Okay.
Okay. Having the right lower quadrant. All right, it's right here. So it seems like that your liver border is right here. Okay, so I'm just gonna feel it again. All right, everything is good there. Okay, so the next one I'm just going to do is lightly palpate just to make sure that everything is good with your 4 quadrants, okay?
Okay.
So right lower quadrant. Any pain here?
Nope.
Any pain?
Nope.
Any pain?
No.
Okay. How about here?
No.
Okay. So I'm just gonna do the same thing, but deeply palpate, okay?
Okay.
Here.
Nope.
Here.
Mm-mm.
All right. So I'm assuming no pain.
Nope.
All right, everything seems good. I'm not feeling no abnormalities with your abdominal. So you can go ahead and put this down. So next I'm just going to do a check for your femoral artery, if that's okay. So first I'm just going to do is feel it on both sides first, one at a time, and then I'm going to listen to it, and then I'm going to feel for symmetry.
Okay.
Okay? So that sounds good. And you can go ahead and flip the camera upwards. Thank you. And so now I'm just going to pull this down if that's okay.
Yep.
And so I want you to do is create a froggy. Okay. So I'm just going to reach down in your pants, okay?
Yep.
All right, I am feeling right here. That's where I'm feeling a strong pulse of her femoral artery. So then next I'm just going to do is listen to it on my bell side. Switching to my bell. And then so now I'm just gonna feel for it again. All right, it's right here. Is it okay if I go under?
Yeah.
Just to make it easier.
Yep.
So now I am right here, listening for any heart murmurs, bruits. I meant bruits, I'm sorry. Okay? And so now I'm gonna do the other side, okay? Same thing.
Okay.
So I'm feeling a good pulse right here, where my finger is. And so I'm gonna do the same thing with my bell side. I'm just gonna go in here, do the same thing, okay?
Mm-hmm.
And so now I'm feeling here. That's where I'm listening for any heart murmurs with her femoral artery. And no, not for heart murmurs, on bruits. All right, not feeling no bruits, no nothing. I'm not listening to anything abnormal. And so next I'm just going to do, and then just feel it symmetrical, okay? So same kind of thing. I know this might be uncomfortable. All right, I felt the pulse on both sides, and it's nice and strong, feeling it on both sides. So I'm right here. Right, perfect. All right, so I'm just gonna go ahead and get some more hand hygiene. Okay, now I'm just gonna lift up the blanket for you. Thanks. You're welcome. And so next I'm just gonna check your legs, okay?
Okay.
And I see that you're cold. I see goosebumps. So I'm just, like inspecting. I do see the goosebumps. And are you aware with your moles on your legs?
Yep.
Okay, perfect. So no concerns with it?
Nope.
And then, so now I'm just going to check for symmetry with your muscle tone, okay?
Okay.
All right, nice and symmetrical. I do feel down here it's a little bit cold. Is that normal?
Yeah.
Okay. So next what I'm just going to do, before I take those off, I wanna, well, actually I'm gonna take it off. Okay. So I'm just checking for capillary refill and perfusion. Just a little slight delay with your capillary perfusion. Is that normal for you?
Yeah, my
and it's really
cold.
It's really cold. Okay. Okay. It's cold on your feet, but then the rest of it is nice and warm and good skin tone and good skin temp. So next I'm just going to do is just make sure that your popliteal pulses are nice and symmetrical. Okay. If you don't mind bending up your knees. Nice and strong pulses here, founded right on the point. Nice and strong pulses, nice and symmetrical. And so next I'm just going to move on to the feet, and then just feeling for your posterior tibialis. You can go ahead and put them up. All right. So I'm feeling for her posterior tibialis, nice and symmetrical, good strong pulses, no concerns. And then now I'm just going to move on to her dorsalis pedialis. All right, feeling them right here. Your dorsalis pedialis right here, nice and symmetrical, no concerns, feeling some good strong pulses. And so before I move on, I'm just going to check in between your toes. Same thing, just seeing if there's any warts, any dryness. I'm not seeing no abnormalities there. And so I'm just going to check on your heels and your feet. And I do see you do have a mole there. You're aware of that?
Yep.
Okay. Good skin color, good. And then just a little cold. And I'm not seeing no skin breakdown on your heels. Oh, and I do see you do have a tattoo. Is that, is there any complications at all with that?
Nope.
All right, I'm not seeing no signs of skin breakdown. All right. So the next thing I'm just going to do is do a sharp and dull test on you, if that's okay.
Yep.
All right. So I'm just gonna have you feel dull, what dull feels like.
Okay.
That's dull, and this is sharp.
Okay.
Do you feel the difference there?
A little.
All right, I'll retry it again.
Okay.
Dull,
Okay. Okay.
sharp.
Yeah.
Okay. All right. Close your eyes for me.
Dull. Sharp left thigh. Dull right thigh. I can't tell the difference.
Okay, hold on.
Dull left knee.
Okay.
Sharp right knee. Dull right shin. Sharp left shin. Dull right foot. Dull left foot.
All right. So I give you an 8 out of 8. I know that at first was a little bit wobbly, but you were able to get 8 out of 8 on that, so I'm not concerned. So that's normal.
Okay.
So I'm just gonna set this down. And so I'm just gonna put your socks back on.
Ooh.
Is that good?
Yeah.
Okay. Just gonna put on some more hand hygiene since I touched your feet. Okay. All right, so you can go ahead and sit up if you like. Oh, and then I'm just going, can I tie this really quick?
Yep.
After when you're done with your hair.
You're good.
I'm just gonna tie this as well. So you're keeping some privacy. Okay. All right, so I'm just gonna put on your shoes really quick.
Okay.
Do you need any help with those?
I can do it.
Are you sure?
Yeah.
Okay. I can actually tie them while you get the other one on if you want.
Okay.
Okay. So first, before we start, do you have any dizziness?
No.
Any blurry vision I need to know about?
No.
Okay. So first, I'm just going to do a Romberg test on you. It's just making sure that you're not swaying at all.
Okay.
Just testing with your balance, which is your cranial nerve number 8.
Okay.
Which is your vestibulocochlear cranial nerve. And it's also testing for hearing, but that was made in the beginning.
Okay.
Okay, so I just want you to do is stand up for me. And then just put your feet out apart a little bit. Put your hands down. And then so close your eyes. And so just stand there for a couple of seconds. All right, you can go ahead and open them. I give you a negative Romberg, minimum swaying. It's really normal, no concerns.
Okay.
All right. So the next thing I'm just going to do is we're gonna walk, okay?
Okay.
So we're gonna do some walking. And let me know if you feel any dizziness and we can stop. All right, and then back. All right, and then so next you're just gonna do heel to toe, heel to toe. All right, over here, heel to toe, heel to toe, heel to toe, heel to toe. All right, you go ahead and sit down. All right. So I give you a 23 out of 23 on the Braden scale. Your nutrition's good. Your skin is good. I'm not seeing no abnormalities with your skin color or skin temp. Just a little bit cold on your feet, but no concerns. I'm not seeing no skin breakdown at all. And you're having some good physical activity. You're mobile, and I am not seeing no continence. So do you have any questions for me?
Nope.
Thank you so much for being my patient.
You're welcome.